The Centers for Disease Control has shifted its guidance on whether touching surfaces is actually an easy way to catch COVID-19. Well, Paul Murphy reports while the CDC reduced the risk, experts tell us public surfaces are still a source of infection.
Sanitizing surfaces, repeated hand washing, and glove wearing have become a big part of our daily routine in the age of COVID-19. While touching infected surfaces has always been a part of the messaging on how the coronavirus spreads, the Centers for Disease Control recently shifted its stance. The CDC is now stressing that the virus spreads mainly through person-to-person contact and does not spread easily on contaminated surfaces. LSU Health infectious diseases expert Dr. Julio Figueroa says the agency is now focusing on what puts us at the greatest risk as we reopen the economy.
To try to really emphasize the physical distancing and the mask wearing and those sorts of things, which clearly are going to make a big difference.
Assistant Louisiana Health Officer Dr. Joseph Cantor says while touching surfaces doesn't account for as many COVID cases as respiratory droplets through the air, it still is a potential source of infection.
And what we do know, without a shred of doubt right now, is that the virus can live on hard surfaces sometimes up to 2 or 3 days.
Doctors recommend that you keep treating public surfaces the way you have since this pandemic began.
Wiping down with a disinfectant the high-touch surfaces frequently throughout the day, doorknobs, handrails, elevator buttons, copy machines, that's going to be an important part of breaking the cycle of transmission.
I would always try to keep my hands clean as possible when I touch surfaces. And so that's one of those things that I think is a prudent thing to do.
The change in CDC guidance is another example of how we continue to learn new things about this deadly virus. Paul Murphy, Eyewitness News.
So are we seeing any kind of effect, positive or negative, from entering phase 1 of reopening? Dr. Cantor tells us there's typically a lag time from when someone's infected with the virus to when they would develop symptoms and get tested. So he expects to have a better idea of the impact in the next few days to a week.